Hello, everyone. Today I will be presenting work done in collaboration with folks at Brigham and Women's Hospital in Boston to extractively summarize medical records to help radiologists find relevant information when making a diagnosis. When a radiologist is sent a patient's MRI, the unstructured text in the patient's medical record may contain information useful for making a diagnosis. However, because the patient record is very long and radiologists have very little time to spend on the patient, often as little as 10 minutes, it is crucial to develop a system to recover pertinent information automatically. For example, if radiologists had time to go through the medical record, they might ask questions like, was this patient ever given blood thinning medication? And try to find evidence of this in the record. The goal of our model is to take a query like this and find information relevant to that query, like that the patient stopped taking Eliquis. The system will then return this part of the medical record to the radiologist for further review. Our model starts with the concatenated unstructured text from the medical record split into sentences. The sentences are then fed through an encoder, in this case a transformer architecture pre-trained on clinical text. Then a query is used as input to produce relevance scores over each of these encoded sentences. Now ideally, we would directly supervise these conditional extractive summaries, but this would require a large amount of very time-consuming expert annotations of extractive summaries paired with their queries. Instead, we treat ICD codes or their natural language descriptions as queries, and treat the relevance scores as an attention mechanism, producing a context vector which is used to predict if the code is a valid diagnosis of a patient. This we already have labels for in the medical record, and the task implicitly trains the attention mechanism to put high weight on sentences that serve as important evidence for or against the diagnosis corresponding to the input code. We also create an annotation interface to collect a small number of annotations in order to evaluate our model. Our results show that at about 20% recall, we achieve well upwards of 15% precision, whereas a random extraction would achieve about 2%. These tables show variants of our model compared with a couple of obvious baselines that use TF-IDF similarity or cosine similarity to compute the attention mechanism. Thanks so much for listening, and feel free to contact me anytime. And a special thank you to my professors, my advisors, Jan Willem van de Miet and Byron Wallace, for their support in this project. Thanks.